How many people have I helped? I can't count them. I've been doing this since 1974. So there's thousands of people. And reliably, in the case of what I do most of the time, which is acupuncture, it's the safest treatment on the planet. There is just no other medical treatment that is as safe. The evidence for its efficacy is growing all the time. There's a huge body of knowledge to explain how it works and how we're manipulating the chemistry of the body. We now have a lot of functional MRI studies showing what happens in the brain when we put a needle in somewhere in the body. And it's like you're poking the body and saying, hey, pay attention to me down here. And then your body makes adjustments that benefit it. And a lot of these chronic illnesses are related, first of all, to poor lifestyle choices and lack of exercise and poor nutrition are two of the main things. There's a huge benefit to people with chronic pain when you make sure that their magnesium levels are good and their vitamin D is good, simple things like that. But you can't patent natural substances, so nobody can get rich from it. And that's a huge barrier. They're really, a lot of them have very complex problems, many multifaceted. And I have to sort that out. I have to, take a good history, do a good physical, use whatever means I can to look at their case both from the Western medical point of view, looking at it with my knowledge of nutrition, looking at it with my knowledge of acupuncture, both from an anatomical and a traditional perspective. And so I'm looking at them as a whole person. And that's missing in our medicine today. In Chinese medicine, they talk about yin and yang. In Western medicine, we talk about homeostasis, meaning we're balancing the autonomic nervous system mainly, parasympathetic and sympathetic, And they're really sort of different ways of looking at almost the same thing. It's a wonderful thing to see what happens when you poke the body and it makes a change. And when people take it to heart and they listen to what you recommend about lifestyle changes and they make the changes and they come back and they say, wow, I've got energy. And all you've done is tell them to eat more protein or something like that. Then you realize, how basic is that? Ask them what they eat. It's the first thing you should do is ask what people eat. It's shocking when you find out.